All right, continuing with that, we will
I
find.
can't see the slide. It's not sure.
Okay, there is similar overwhelming data on exposure to trauma. As it increases, the percentage of people who are exposed to higher trauma is higher in terms of suicide attempt history. I'm not talking behavior, attempt. So individuals who are exposed to higher trauma are more likely to have attempt history. So again, there is a lot of talk about stress. For example, medical students or competitive institutions attempting suicide. The background goes much beyond when they started studying in advanced institutes or high-end institutes. The background of, as you see on the below, right, emotional abuse, neglect, when present, is more likely to cause a suicide attempt. Is this
I
clear?
think so. So here is the thing: when we are looking at suicide behavior and suicide attempt, we are seeing young people or adults with low emotional resilience, and which is why they succumb to suicide. And emotional resilience also is affected because of the entire trauma baggage that they carry from childhood. So children who have grown up with less childhood trauma, healthier functional families, are better and more emotionally resilient even to challenges and stress, versus children, say, who have grown up with more than five or six of those ACE elements present. So the emotional resilience is affected, which is why, again, the risk of attempting suicide increases a lot. That is our understanding.
Okay, shall we continue? I'm going to keep moving so that we are continuing with that. The relationship issues are also more prevalent in people with higher exposure to trauma compared to low exposure to inner child components. Overwhelmingly, 7 out of 10 people with high exposure come with relationship issues. This is regardless, either with parents, spouse, children, friends. This is seen across. Again, a behavioral component of inner child. Like I said, those with percentage of people with emotional abuse and neglect present is higher, okay, in suicide attempt issues. So that also indicates the inner child role in certain behavior. I'm going to keep moving, but let's go back to some idea on how we work therapy. Before we go, are there any quick questions that we can answer? By now, you should know what are those components of inner child, right? How they affect inner world, or as psychology we call it internalizations, like depression, anxiety, trauma response, resilience, so on, and how it affects the behavioral aspects such as relationships, self-harm history, irrational decision making, suicide behavior, and so on. By now, looking at these slides and the earlier talk, you should be clear that there's a very overwhelming connection with everything we call it as psychiatric issues. It may not be a pretty happy discussion, but this is a reality we see in our daily work. And unless we assess it, we are not able to identify the correlation between the experiences and the behavioral or internalization issues. Questions? Anyone? Okay.
In the chat, okay, Shivani. Shivani, yes, you have a question?
Yeah, hello, yeah. Good evening. I'm Shivani.
Good evening.
Yeah,
Hi, good evening.
is there any scale of measuring a trauma somebody undergoes, like a death of a parent or losing both the parents would be a stronger trauma than maybe abuse? Is there any scale to measure the trauma and how it
Very good
impacts
question.
the, yeah.
Loss of a parent, especially before age 18, is one of the questions. I didn't mention it. I was not reading through each 16. It is not just parents, somebody who has been a primary caregiver. So yes, that is obviously part of the 16. And we need to look at situations beyond age 18. Second point, Shivani, is that there are certain things that we understand even as children that can happen naturally. Death is one such example. There are other things that we cannot comprehend as happening in nature. Examples: emotional abuse, incest, and so on. The abnormal incidents tend to generally, I'm generalizing, have a much stronger impact on internalization and externalization. I hope that answers your
She's
question.
asking about scale. How do you measure? So trauma
Scale
is
we talked last time. Yeah.
trauma is essentially very subjective. What can be traumatic for one person may not be traumatic for other person. But yes, when it comes to PTSD, we do use assessments. We use
So scale, I will
certain
repeat. Scale, there are multiple ways. What we do is we measure binary yes or no in the 16 questions, as you see on the visuals. That's first point. In addition, what is not shown here is we measure the frequency of occurrence from 0 to 4. 4 is very frequent, then frequent, sometimes rarely, and never. These two components. These are actual things happening and the intensity or the frequency of it. After that, we also measure internalization and externalization components. I hope
and
that answers the
ITQ. We
question.
also do the PTSD.
That is part
Okay,
of the
right.
trauma.
Right,
Yeah.
right. Thank you.
So we use scales for trauma measurement as well. And like I said, it can be subjective, but we follow the client's subjective experience. So if the client says that, well, my physical abuse was, according to me, it felt like it was very severe, happening very frequently, then we take it as, as that was the client's own
So hold on.
subjective
The
experience.
top three, we will talk about trauma measurements. However, just to give you an idea, if you have done work on PTSD, there's something called index trauma. So after all of this is measured, we identify index trauma, and there's a structure for that that helps us identify what is the most important set of events that may have the highest contribution. And this could come out of nowhere from the list also.
Right.
Okay.
Okay. Thank you. Yeah. Okay.
Okay. So when we are looking at therapy approaches to this, here is the approach that we take. We work on essentially recognizing that uh, all the experiences that we have gone through are stored as long term memory, which is implicit and explicit. And it is an implicit memory which is stored in the body, which is basically the cause of most of our automatic unconscious responses and reactions. Explicit memory, is also there, and implicit is there. When we look at trauma work or when we look at therapy relate inner child work, we are essentially dealing with the implicit memories, which is the non-verbal, but the unconscious, subconscious body memories that the client is holding related to the trauma. And inner child work basically is addressing the memories of trauma and overwriting them or neutralizing their effect, so that it does not impact the adult client's present experiences, because whatever happened was in the past, but that past is stored and keeps coming up in the present because of the implicit memories, because it is in the body, it's in the body and the mind, and it is these memories that we have to revisit, overwrite, reassociate, reframe, so that they do not affect the client in the form of unconscious or subconscious responses or impulsive reactions and behaviors. So it is an implicit memory. So any event, like this slide shows, any event that we go through in childhood, which is a strong event, not a small thing, but major events in life. They are basically recorded at two places. One is in the body. They are recorded as what did I feel in that experience? What was the emotion in that experience? And then at the same time, there is also our rationale, which says, okay, so why did this happen? How can I prevent it from happening again? How do I cope up with it? What do I decide about myself so that I don't get into the same situation again? And these are what we call as the coping structures or the coping decisions, which also become the focus area of work when we do inner child therapy. So coping decisions could be things like, oh, if I want my mother's love, I always have to be unwell, or I always have to speak loudly if I have to be heard, or I always have to be responsible for other people and keep them happy if I have to be important or valued. So these are all coping decisions. And coping decisions, other than the trauma events, we also work with belief systems and coping decisions that are related to specific events. Even belief systems, like, we had a client who had a belief system around money, that I cannot spend money. Now, that is not her present reality, but it was coming from childhood because of one or two very strong experiences she had experienced as a child related to lack of money. And from the age of 12, she made a decision that money is hard to get. Money cannot be in abundance ever. Money is always short. And so even as an adult, when she was making tons of money, that belief system continued. So these are the different issues we address when we do inner child work. Basically, the focus of inner child work is contacting that part of our consciousness, our personality, our belief system, or our whatever you call it, that part of our memory which is holding that decision, belief system, or trauma, releasing it. By releasing it, I mean doing body work, breath work, releasing it even through logic, implicit, explicit memory, both are addressed here. Healing it. By healing, I mean understanding a different perspective, replacing it with a different belief system, understanding it from a different perspective, reframing the experience in the mind, all of that. And then integrating it in the present moment. So for the clients, this last two steps are very important. When they heal those frozen, stuck parts and integrate them into the adult consciousness, they start becoming more and more empowered as adults, because now their personality or consciousness is not fragmented into helpless part, neglected part, unloved part, angry part, hopeless part, frustrated part. But the more and more these parts are healed and integrated into the present reality, the client is now able to operate from the present moment, from the present adult self, versus being a slave or versus being hijacked by the wounded or hurt inner child parts. So integrating, which leads to being. By being, we mean empowering the client to be in the present moment and operating from the present adult wisdom, and not from the traumatized, hurt, abandoned inner child part. So that is the focus of inner child work. And this is the whole process. As you see, we teach our therapist in depth on how to do the intake, how do you identify the problem, presenting problem versus core issues. We do a lot of forms, assessment tools we use there. We make detailed timeline to identify what are the inner child events in the client's life of, say, 35-40 years. And then we follow this whole inner child process. And Gunjan will share some results that we've had in this process. Inner child is what we teach as module 3 in our entire 6 module program. And in our opinion, this is a very important module. That is why it is right in the center of the whole 6 module curriculum. And why it is in the center at module 3 is because we do use some hypnosis, hypnotherapy, guided imagery, visualization in this module, which is taught in module 2. So the modules are also stacked up in such a way that we start with first self-care, then learning basic tools of how to work with clients, doing guided imagery, visualization, some body work, regression using hypnosis, etc., and then coming to the module 3, which is the inner child work, where we now start working with in-depth childhood traumas, belief systems, and all of that. And here we use hypnosis, hypnotic and non-hypnotic methods both. So when we do when we train our therapist in inner child modalities, we expect them to know how to use hypnosis also to do this, and you can also do it without hypnosis by using effect bridges. So these are the 2 approaches that we use with inner child. Now over to Gunjan for the results.
So what I'm sharing with you is been partly supported, funded by the Earth Association for Regression Therapy. We did a study where they funded some of our work to look at how the modality we use can generate meaningful outcome. And we also have a control group, and I'm not sharing that data for obvious reasons right now. So if you look at this, when you talk of measure, right, Shivani, people who come with poor well-being, desired well-being is 52. After 4 sessions, their well-being improves, anxiety decreases, depression goes down, and sleep quality, insomnia gets better. Okay, this is sleep quality issues. If you look at records after 4 and 8 sessions, they cross over to a healthy well-being, no anxiety, no depression, and good sleep quality. This is records of only after 8 sessions. And by measuring multiple such components, we are able to ascertain, and of course, there is a confirmation with the individual who we are working with. So this together helps us understand how this method is effective. Okay. Please note here that people with higher trauma exposure, as I showed at the beginning, um, come with higher level of depression. They also recover, but they need more time compared to those who don't have such inner child complexities. Is this clear? I'm just looking at somebody's chat. Voice is low. Can you hear me? Hello? Can everybody hear me?
Yes.
Yes, we
Okay,
can
good.
hear you.
Okay. Is this clear? So there is similar data on anxiety. People with higher trauma exposure come with higher level of anxiety. They also recover. They need time, as you saw in the data after 4 and 8 sessions. So this is universal. Um, sorry, I'm just chatting, seeing the chat. Uh, to summarize, multiple components of internalization get better. Now, some of you may be wondering what happens to the externalization of behavioral issues. They also can get better. They need work. First, the change usually is apparent in the internalization parameters, and often people need coaching to be able to guide them that the environment that you took such decisions of social anxiety, for example, not meeting people, was a traumatic, violent home environment. No longer you are in that situation. However, you continue to isolate yourself from people. And this requires a different approach, and this can be addressed. I'm not sharing some of those data here. All right. So what? And this is the fourth or the last point of our question or of our structure. Please recognize and work on your trauma. This is such an important area as an individual. We will talk about the post-traumatic stress disorder in the next talk. However, if you are dealing with any situations, whether it's insomnia, depression, anxiety, or well-being issues, and not going anywhere, then challenge and work to identify the trauma, its footprint on your mental health, and address. Second, use evidence-based, measurement-based approach. Not come and let's work on something and feel good and go away and come back again. You were saying something?
No, I was just saying that what we have also seen is when we have clients who have come with severe trauma, sometimes they have taken 40, 50, 60 sessions of counseling and they have seen no result. But result is there in some levels of external behavior change, but the trauma work does not happen with just counseling. So counseling works wonders for people who have less trauma, who just need some behavioral changes, some tweaking here and there. But when we are looking at severe trauma, more than 5, 6, or 8 trauma score, then these people do not benefit as much from just counseling. We really need to work on the body memories, which is implicit, explicit memories. We need to work on recognizing them, reframing them, reassociating them so that they can get neutralized. And these people then, after 4, 8, 12 sessions, say that we are getting less and less triggered, we are able to be more and more mindful and present, etc. So what we are trying to say is if you have a trauma history as an individual, a severe trauma history, then simply just coaching, counseling will not do the job, because we've had too many clients by now who have told us that they've done all of that and it has not worked. Yeah. But if you don't have a trauma history and there are minor issues that you need to take care of, simple anxiety or some negative thinking, then yes, counseling would help. So counseling it's not like it doesn't help at all, but the trauma work doesn't happen by just counseling. That's all I want to say.
Additional support on this is if you look at post-traumatic stress disorder results compared to CBT, EMDR, eye movement desensitization and reprocessing is more effective. And dropout rate is higher in CBT. So this is backed by a lot of evidence. And that comes to the second point where if you're working with individuals, you need to measure both the inner child components, trauma, internalization, and externalizations. Yes, anyone can help provided there is right skill set. I am not a psychologist. Okay, I am an engineer and I work extensively on trauma. So it is, if you can chat hold on to the chat a little later, because then it's difficult for us to concentrate
We will
very
reply
well.
to all the
Reply to
questions
all
on
the
the chat
questions.
together
Keep
at the
sending
end
it.
of the workshop.
I'll reply.
Keep posting your questions on chat. At the end of the talk, we will answer all those questions.
There is
as
a
well.
video. The question here was, if somebody has been for a long duration on psychiatric medications, will this help? We usually don't use hypnosis in such cases. We use non-hypnosis methods, and we do work, and we also collaborate with psychiatrists to facilitate reduction in medications. The longer the duration of medications, the harder it is to work. And if you look at the video, uh, it says evidence-based that long-term, compared to psychiatric medications, psychotherapy is effective. Medium term, both are safe.
Also, in the question you asked that 10 more than 1 or 2 decades of medications, what that does is when a person has taken psychiatric medications, antidepressants for 10 to 20 years, then inner child work becomes a little difficult because these people are numbed out. So it is very hard for them to even recollect the childhood trauma memories. It is hard for them to recognize how those affected them, what were the emotions that were involved, where in the body were those emotions stored, how is it showing up, because their brains are so numbed out by the psychiatric medications that we find it very difficult to work with such clients, because their awareness is also reduced, their connection with the body is lost. So when we have clients who have taken medicines for 20 years, we are very a little skeptical of working with them. It's much easier when they come to us as soon as they start medications, or even before they start medications, because then the effect of the medications is not so severe, and our therapies are much more effective.
Okay, so those who are working on it understand the trauma, its impact. And we are talking about two things here: inner child as well as post traumatic stress disorder. They are interconnected in terms of correlation. Please use evidence based approach. So if you're using a method A, make sure you have scientific evidence backing that method for a scenario B that you are attempting to solve, right? Also understand what are the effective methods for post-traumatic stress disorders, and finally keep learning, because what worked 20 years ago may not be effective today. Classic example is in DSM-5, which is a Bible for psychiatry and psychology mental health issues. Complex post-traumatic stress disorder is not defined. However, it comes into place in ICD-11. So if you use DSM-5, it's unlikely that you will deal with functional impairment that follows PTSD. That's called under a different category called disorders of extreme stress, not otherwise specified. So there is a lot of jargon here, but to drive home the point, if you don't measure or don't keep learning as a therapist, you are likely dealing with old methods, and it may not be as effective, especially if it's not backed by published scientific data. Okay, moving forward. To summarize, we are talking about a complex correlational situation from childhood trauma to internalizing to externalizing problems. And as our data demonstrates, that it is possible to identify the inner child, identify which of the components is a problem, and deal with it. With that, I recap. We started with what is the problem, how trauma load or inner child impacts several um, mental health issues, what kind of interventions do we do, how are the results, and so what? Whether you are a homemaker or you have a trauma load or you're working as a psychotherapist, this can be dealt with. So Reed is going to take us through a few more slides. That's it. So we can go ahead with some questions. Speak up. You can unmute.
Yeah, so that was a bit about inner child therapies. Let me just quickly go through, just quickly tell you that we have 2 more talks coming up. Talk 3 is how uh, uh, inner child work is related to parenting, and how some of these things have a role to play in your parenting styles. So talk 3 is going to be all about inner child work, and how what is generational trauma, how it affects parenting styles, etc., and how it is important for parents to also recognize and work in healing their own inner children. And talk 4, of course, is going to be about inner child and complex PTSD, what is PTSD, CPTSD, how it is linked to ADHD, BPD, and all of that. So this is all about talk 3 and 4. And before I end our bit, just to share that we have the Journey Within workshop coming up in this month for all those who wish to take their first step towards becoming therapists or doing self work in understanding more about mind, implicit, explicit memories, energy, physiology, stress, coherence, self care techniques to manage all of this. And those who wish to learn inner child healing, we do have our batch coming up in November. But for that, you would have to do module 2, which is learning basic hypnotherapy methods, guided imagery, anchoring, etc., to help people connect better with their inner child. So, for doing module 3, ideally, module 2 is also necessary. But if you can't join for some reason, then you can still join module 3 and later on do module 2. But these are the two programs that are coming up where we do work with childhood trauma and past painful experiences. In module 2, also, we do a basic age regression using guided imagery, which is also quite effective in dealing with childhood experiences. So, now over to you for questions. Please ask your questions. We'll also go through the questions in the chat. Please raise your hands. Anybody? Yes, Urmi, you have a question?
Uh, Hello.
Yeah, please ask.
So, am I audible to you, ma'am?
Yes, yes.
All of the first, I would like to thank both of you. I have been following your videos on the Facebook, and I have benefited a lot with the knowledge that you have been sharing, and that also for free in today's world. So, thank you so much for that, and also thank you for today's webinar. I reside in Surat. If you have heard the name of Bardoli, it's a little town
Yes,
near Surat.
yes.
Bardoli,
Yes.
yes. And I was
Satyagraha town. How do we forget?
yes. I was working as an assistant professor. I was teaching English to students, and I have been taking baby steps towards becoming a therapist because that's my passion, and now I want to follow that. So I think this is my first step towards that. And I have no questions actually, but I just wanted to express my gratitude to both of you because I have been watching both of you. I have been benefiting with the knowledge from both of you for a very long time. And
Thank you.
so, yeah, thank you.
Thank you so much. Thank you for that.
And I actually I have a daughter, and I have even today I'm not able to participate so actively. I'm outside, but if time permits me, then I'll come to Ahmedabad, and definitely I will learn something from both of you. I'll attend something, whatever I can.
Sure, definitely. See, you can join. All our trainings are online because
Yeah.
and all the
Yes.
data that you saw is of
Yes.
therapies that are done online. 80% of our work today is online, which was quite
Yes.
unbelievable for a whole lot of
Yes.
therapists who are trained in the traditional ways. In fact,
Yes.
when we presented a lot of our research in the conference in Romania, which was
Yes.
organized by the Earth Association, they were quite surprised that you're actually doing all of this online. And in fact, all our therapists are trained to work online and offline. So while offline is also there, but they all are very confident about doing all of these modalities online. So we can reach
Yes.
out to people across the world. We are not limited by time, space, logistics, travel
That's
cost, etc.
yes.
goes down. We are able to
Maybe
reach out to
yes.
people in every corner
Yes.
of the
Yes.
country and the
That's
world.
true.
So thank you
That's
so much,
true.
Urmi, for your
And that's the
for your
reason maybe if only if it is online, then I am able to join today or
yes,
meet you today.
absolutely. No, it is
Yes.
absolutely. All of these modules are online.
Yes.
Definitely.
And
Wonderful.
I had one question related to today's topic.
Yes.
How to identify? I mean, I have seen some people, some children, some grown-up children, and they even don't know that they have gone through the trauma. So, particularly, how to understand that they don't know which incident is called a trauma.
It is subjective. So if it has affected them as a child, not
Yes.
as an adult. So as
Yes.
an adult, you might say, ha, I got hit like every day, but that was for my own good. That was for my benefit, blah, blah, blah. Then that is not what you're looking for. We are looking for, okay, as a child, whatever went on, how did you feel as a child? If that person says that, yes, this did affect me as a child, it made me feel helpless or hopeless or scared or fearful, then that is
Okay.
trauma. But
Okay.
again, it is subjective. Like I said,
Subjective.
even
Yes.
two children in the same household who have gone through exactly the same experiences may have very different impact of the trauma, because trauma is subjective by definition.
Okay.
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 Next
Yeah.
question, Bhargava,
Thank you.
Manisha. Wait, I'll first answer the ones who've raised your hands, and then I will answer the ones in chat.
Hey Riri, hello Gunjan.
Hi. Hi.
Thank you so much. Finally, I'm
Can we
able to
see you?
talk to you, Riri.
Can we see your face, if
So
possible?
we will
Somehow the
entertain
video is
questions.
not working. I really wanted to
Okay,
have
okay.
a
No
face.
problem.
I'm so sorry. Okay, for this inner child therapy, as we discussed that we can apply this therapy to the adults to understand that the trauma they faced as a child.
Yes.
But I would like to understand in a situation where suppose a child has undergone a trauma, he was provided with some kind of counseling to cope up with. Can this trauma again haunt him in the future as an adult?
Well, I will answer, then Gunjan will answer also. In my opinion, if that trauma has only been logicalized or rationalized and not really worked upon in terms of reassociating or reconsolidation of that memory, then there is a high likelihood that as adult, when the coping structures collapse, the trauma impact will once again start affecting. But if the deep work is done, which means if the trauma is released from the body, if the implicit explicit both memories have been reframed and reconsolidated, then in my opinion, that is deep work, and then it will not come up later on. What do you have to say?
So the simple answer to the complexity is that you need to define the traumatic events, measure it, address it, and measure it again, and validate with the child. If it is effective, it's likely that you won't need to work on it. Simple
And
answer.
just in case if we need to work upon it again in a very
Then
sad
same
situation
process.
where things
Same
come
process.
back again,
Same
how?
process.
Yeah, please tell me.
Same process.
Okay, okay. So the degree of trauma at that time in the adult phase, will it be obviously different or it should be lower than what it was at the time of
It depends. It depends. The way we address trauma is built into our mind and body. So we have the capability to process it and deal with it. First stage is acute stress disorder after a month when we are not able to process it. So generally within a month, most traumatic situations can be self-managed. And that's a separate topic. During sleep, there's a stage that processes it. Beyond that, it can remain dormant for 20, 30, 40 years because triggers are required for traumatic response to come back. Implicit memory, in case
Correct.
you have seen that slide, correct? So it is difficult to just have a talk and identify trauma and address it. That's a more complex answer to your questions. Correct? So inbuilt, there is a mechanism to deal with trauma. Hence, not everyone who goes through an earthquake ends up with traumatic experiences. And even those who go through the traumatic experiences are able to manage functionality and get it back in about a month's time. Okay?
Okay, fine. Thank you so much. Thank you.
Puneet Sainani, you have a question? Puneet Sainani, you've raised your hand. Do you have a question? Okay. Okay, so let me answer now the ones. Shivani Dubey is asking, does prayer or meditation heal trauma? Depends on the intensity of trauma. If it's a very mild trauma, one earthquake experience or some medical trauma, hospitalization trauma, it might help. But in our experience, most people who come to us have severe trauma, and just prayer or meditation does not help. Even just counseling does not help, just journaling does not help. We have to really have a multi-pronged approach. So we have to work on their nervous system to their nervous system regulation. We have to also do trauma work, which is deep work on the memory and body. And we also have to do counseling and coaching. So we have to have a multi-pronged approach. Yeah. Yes, Puneet, you wanted to ask a
Yes.
question.
Yeah. Am I audible, ma'am?
Yes.
But not visible. Puneet, video lagaiye.
Sorry, sir. Yes. Hello.
Why?
Hello,
Go ahead.
sir. Sir, I have taken 2 sessions from you. Do you remember in the month of March, actually?
We don't talk that here
Con-
online. So up to you.
So, yes. Sorry, sir. So I just wanted to know my fears. I'm not able to erase my fears right now, actually. So should I take the journey within session or the healing one
No,
part
if
one?
there is a specific request see, by the way, for others, I'm generalizing it. When there is irrational response, it is to specific situation, it is specific phobia, and there are fears. These are both common outcomes of traumatic experiences,
Exactly.
whether it happens in the adulthood or child. And they need to be handled separately in an individual session versus a group. So
Okay.
module 1 won't
Right.
cover it fully.
Okay. Thank you so much. Thank you so much.
Yeah, and again, I would also say that yes, when your childhood trauma score is 4, less than 4, well, after 4 or 5 sessions, people see benefits. But when childhood trauma scores are more, we really need
Time.
You need time. We've had clients who've done sometimes 15, 18, 20 sessions, and then they start seeing the change. So if the trauma load is high, then the number of sessions required also significantly goes up. We cannot do 2 session, 4 session magic. Just saying.
No, but I just wanted to know whether I should join the journey within, which will it help me out?
No. So no need, because you would have been taught the techniques in one-to-one if you have taken
Okay.
sessions. I don't know
Okay.
See, for confidentiality, we do not discuss personal client
Sure,
details.
sure. Thank you so much.
Okay.
Thank you.
But you got the answer, right, Puneet?
Right, sir. Right.
Sunil Shah, you have a question?
Exactly, it is something not of a question. I mean, I have been facing something and like I lost my parents in COVID. So being brought up and as a single child, what has happened that constantly is something like my parents are with me. I could not do something about them during COVID as I was in hospital and cases like that. Okay. So what is happening that I'm in a guilt feeling, okay, that I didn't do something. They had done so much of things to me and so much of care. So in this situation, how this kind of situations can be handled and how the things can be handled. I mean, what you would suggest?
Yeah. So I would suggest for people like you, we have a specific process for grief work, where we actually in the therapy session allow your body to
मैं जा रहा हूँ फिर टेनिस
process
खेलने।
and release. Can you everybody please mute yourselves? I think Puneet, can you please mute yourself, Puneet? So we allow your mind and body to process and release all the negative emotions related to that event, which is, the guilt, the regret. And we actually, uh, allow your mind and body to do through guided imagery and hypnosis all the things that you could not do. So incompletions are covered, the voice dialogue is done, body charge is released. And in 95% of the cases, we have seen that afterwards people have told us that now when we see the picture of this person or now we talk about them, we do not feel anything but a positive emotion that they've chosen for themselves. So हम उसमें hypnotherapy use करके grief work का हमारा एक specific process है one-to-one therapy में, वो हम करते हैं तो 95% of the cases में हमें बहुत अच्छा result मिला है. इनफैक्ट उसका हम अभी research भी publish करेंगे. बिकॉज इसमें आपको क्या है, जो आप कोविड की वजह से जो नहीं कर पाए कंप्लीशन, आप उनके साथ वो सारा आपके बॉडी को करने देना पड़ेगा पूरा. वो हम लोग नहीं करने
Okay.
देते हैं बिकॉज ऑफ वेराइटी ऑफ
Yes.
रीजन.
Okay, fine.
तो वन टू वन
So
थेरेपी में ये एड्रेस होगा.
okay, so I need to connect with you on the numbers you mentioned in this template, right?
Yes. You can reach
Okay,
out to us on Instagram, Facebook, on the numbers, wherever. Correct?
okay,
And let
madam.
us know.
Okay.
Yeah, maybe one or
Okay.
two sessions of just grief
You
work
are
should be
based
enough.
out in Ahmedabad only, right? I just
Yeah, we are
figured
in
out.
Ahmedabad, but all our work is also online. So we have clients across the globe. Ahmedabad में बहुत limited है, but Ahmedabad, we are based out of Ahmedabad. Yes.
Okay, fine.
Okay.
So,
Yeah.
okay, fine.
Cool. Rekha is asking, I'm planning to do module 2 from Indonesia. Would it be difficult to get my sources? I don't know what you mean by sources, but you can definitely join from wherever in the
People
world.
join from Kuwait to US to all over. So
We've had people from all over the world doing these modules because they are online. And for the case studies, yes, you can get your sources from there, or we can help you with that. Deepika is saying, if a parent has 2 children and sees the physical abuse in their childhood between parents, can it affect only one child and less effect on the other? It affects both the children, but it can affect differently. So, physical abuse, like I said, trauma is subjective. If a child is emotionally resilient, or if a child is emotionally more stronger, then he or she may be less damaged than a child who is more sensitive and more weak. I think Gunjan also wants to say something here.
It's subjective. We've had cases when a sibling has been beaten up and the other sibling comes for the pain that he or she went through just by observing physical violence to the other sister or brother. So, yes, physical abuse, whether we accept it or not, has a deep impact. On the surface, many of us, in fact, if I put numbers, you'll be surprised. 91% of the men who come to us who have been physically abused do not put yes there and say, this is normal, chalega, aisa hi hai. क्यों लिखना है?
सबके साथ होता था,
When
सबको
you don't
पढ़ती थी मैं.
mention that, often 80% of those, more than 80, who experience physical abuse have also experienced emotional abuse. And about 70% of them have seen domestic violence. Now, ignoring physical abuse, often they ignore other things. And therefore, we don't identify the core issue that causes the problem in their life. I hope that answers your question. Somebody asked about anxiety. Yes, anxiety has multiple ways. Younger individuals tend to be more anxious, Gen Z or Z, as you mentioned. And yes, they can be helped.
Okay. I think that's about it.
Yeah.
We have answered all the questions so far. How does birth trauma get released? Well, again, uh, it has to be done implicitly and explicitly. We've had womb memories also, which we have helped client release through our therapeutic modalities, and also birth trauma like forceps birth, or being rejected at birth by the mother or the father, or a difficult birthing passage. So all of this, we have to work with the body, the memories that the body is holding implicitly, and the related memory of the mind. So both these areas we are working.
So Deepa is asking, and I'm reading that from my phone. Physical abuse has this question: did a parent or other adult in the household often uh, push, grab, slap, or throw something at you, or hit you so hard that you had marks or were injured, and so on? So there is very well structured definition worldwide on physical abuse.
Yes, as children, we were brought up with, not all were brought up by beatings, but yes, beatings were very normalized. But that does not mean that because they are normalized, it does not have effect on the child. It does affect the child, but normalizing is the coping structure. So we all say, like I said, so many clients have said, ma'am, हर रोज मार पड़ती थी, but सबको पड़ती थी, तो उसमें कौन सी बड़ी बात है? इसको कहाँ abuse कहा जाता है? इसको abuse नहीं कहते. This is a part of growing up. But again, these are the same clients who do have anxiety issues, depression issues, relationship issues, sometimes sexual dysfunction. They have issues with authority. They have self-doubt. They have low confidence, and they are not able to logically link it to the physical abuse because they have normalized it. But research shows that when there is physical abuse and the body goes through toxic chronic stress on a daily basis, there are changes in the physiology. There are changes in the way the brain develops. In fact, the neural pathways in the brain and the brain structure, the amygdala, the hippocampus, the prefrontal cortex, the both the hemispheres and the corpus callosum, they all develop very differently when there is severe physical abuse and childhood trauma versus no physical abuse and childhood trauma. So yes, beatings come under physical abuse. People laugh about it, normalize it, cope up with it, make jokes about it, but that does not mean that it has not affected.
Sir's wellness space, physical abuse, you have data. Those who are physically abused come with much higher level of anxiety in a severe category compared to those who are not. These are young individuals I'm talking about. So yes, it is something that we need to recognize. And remember, I've shown you earlier, compared to physical abuse, emotional abuse has a much stronger impact.
Much deeper
And imagine
scars.
both happening together.
And physical abuse also is very interesting. So even if a child has not been abused but sees the mother being physically abused or the sibling being abused, the impact on the brain centers and physiology is exactly the same as if he or she himself were abused, because the brain or the mind, subconscious mind, does not differentiate. The body doesn't understand the difference between it's happening to me or it's happening to them. It induces the same fear or stress response in the child's body as if it was happening to him or her. So even witnessing violence, domestic violence, or witnessing your own brothers or sisters being beaten up every day can have exactly the same impact.
We've had cases where that's happening in the neighborhood or in the neighbor's home, and it has affected the adult who I have worked with. So it's very easy to undermine how this doesn't affect us. In reality, it
And the
does.
only way that, as I'll be very honest, as therapists, we also get overwhelmed and overburdened because of so much of mental health issues that we are faced with. So our biggest thing is now building awareness, because prevention is the best way. Parents need to know that they can raise children without physical abuse. In fact, most parents believe that they can't do it. That is the problem. That is where the trauma passes on generations. Parents ये मानते हैं कि बिना मारे पीटे बच्चों को डिसिप्लिन किया ही नहीं जा सकता है. And this is the myth that we are trying to break. That is why we are doing these talks. We are doing parenting workshops. I'm giving so much of content on parenting on Instagram for free, because I do believe that even if out of 100 parents, 2 parents stop beating up their children, the burden on mental health practitioners will reduce. So awareness is a big thing that we are really working towards, because then only बाद में सब डैमेज होने के बाद हमारे पास आते हैं तो हम लोग तो काम करते ही हैं, but it is very hard.
So with that, we end. If there are any questions, last questions, otherwise,
Please join
thank
the
you.
talk 3, which is can we share that slide again? So just so that you know, we have talk 3 and 4 also coming up. Where is that? 1 minute. Yeah, talk 3 is on 30th September, and then we have talk 4 on 2nd of October. So those who are interested, do join talk 3 and 4 as well. See you all. Okay.
Bye-bye.
The recording will be put up. Sorry, we forgot to record from the beginning, but somewhere in between we recorded it. So we'll be putting it up on YouTube if you want to share it with whoever else that will benefit from it.